Good afternoon, everybody. Please tell me, am I audible and visible? Hello? Can anybody tell me, please? Can you hear me? Yes. Thank you, Dr. Sakina. Thank you, Dr. Masira. Thank you. So, welcome everybody to this cancer webinar series. And today is our fourth session. I'm so happy to have everybody here. Okay. So today myself, Dr. Yamini Ramesh, me and Dr. Hardik will be taking this session. So without wasting time, let's start the session. And if you have any questions in between at the end of the session, you can just type in the chat box and I will try my best to answer them. Okay, is my PPT visible? Can you see this? Yes, great. Thank you so much. So, see, I'll tell you, when we conceptualized this whole webinar series, it was about making people aware and at the same time confident that how they can handle cancer cases, because homeopathy has a lot to offer in cancer. In fact, in all the complex diseases, whether they are autoimmune diseases or carcinomas or deep pathologies and whatever it is. So we have a lot to offer, and a lot of people I have seen that they fear taking such cases, or they are confused, or underconfident, and a lot of such things. So we just thought that we should create some awareness, and we could share whatever we know or whatever we have done so far, along with other speakers. And then we started this series. That's why we kept it for everybody can attend, and it was a free series. I hope you got some benefit out of previous sessions. And today also I will try to keep things very simple. And one thing which I have observed, that a lot of people have this anxiety that what we should do and what we shouldn't do. They don't know. So today I just want to talk about do's and don'ts in cancer, and also how to approach cancer cases. Very simple. Okay. If you have any questions, just let me know. And if you feel that this is very basic, then you can also, contribute to my knowledge or contribute to whatever we are discussing. It would be really great. So let's start. Okay, so सबसे पहले how to approach homeopathic approach to cancer cases. So when we hear this name that, oh, our patient has cancer, we are, a patient along with the doctor, we are little, less hopeful, I would say. And that should not be the thing. So whatever you are doing, just do it with confidence and with good skills, great skills, so that you will be able to offer a lot of help to the patient. So first of all, please don't forget your basics. We are holistic healers. We believe in the in the concept of holism. That's why our case taking should be also holistic. Don't only look at the pathological symptoms. They are the most important ones, but also your generals, your mental state, that will give you or lead you to the right remedy, that will also help you to differentiate amongst the remedies. So take everything into consideration, don't leave anything, and spend more time understanding pathology, because we are not oncologists. Okay, we are not pathologists. So sometimes it happens that we have a basic knowledge of the pathology, but we do not know about the staging, about the progression, the prognosis, possibilities, and all that. Please spend some more time Googling things. Okay, in this case, I would highly recommend you Google things, because and don't depend upon the Wikipedia sort of websites, because they are edited by general people, but you can spend more time in reading the medical websites, or the websites which are authentic. Okay, also you can just go through the books which you have, the pathology books and other books. So spend more time understanding pathology. This is very, very important. try to understand histopathology, staging and progression. It is of utmost importance. If you leave this, you will miss a lot. You cannot just leave that, okay, even if I don't understand, I'm just taking a case and I'm just prescribing the right remedy. Cancer is a very complex disease. So there are a lot of, it's a multi-factor disease. A lot of things affect it and affect your medication also. So that's why you need to understand the staging histopathology and how it goes and what is the general prognosis and all those things. If it is required, if you're not able to understand or absorb the whole pathology by yourself, you can take help of somebody, okay, some specialist or some other doctor that will only help your case and your patient. If there are any secondaries, what is secondary? When the cancer spreads to other organs through lymphatic tissue or through blood or any, with any by any way. This is called as secondaries or metastasis. So when it is metastasized, please go through the report. Sometimes it helps you to pick up the right remedy. In fact, not sometimes, most of the times, I use Dr. Sarkar's approach. He says that, if the breast and this organ is involved, this is the remedy. If the liver and bones are involved, this would be the remedy. So, 2 organ or 3 organ or multi-organ involvement will also tell you, the of course, how the disease is spreading, but it will also help you to choose the remedy. So sometimes that is also that is also one help which we could get directly from the pathological reports itself. Then try to elicit the family and past history with great detail. It's very important. I myself have observed this, that in earlier days, like in my early practice, I used to take past history, but I never knew that how to use that. If suppose patient is saying that in childhood I had primary complex, and that he had primary complex or say TB or malaria or typhoid or whatever. Now you have taken the history, but you don't know what to do with that history. This becomes very important. Have you ever observed this? I myself have not only observed this, in fact, suffered with this thing that, what do I do with this particular history? I never knew that. But now, especially in deep pathological cases, when you understand the progression of the disease, this complexity, you will understand that these things help you. So if somebody has some particular organ involvement in the past, say if he has tuberculosis, there are remedies which actually has TB in the past, or the stint of TB is there, and that's how you actually choose that remedy, because this could be a remedy which was there in childhood now also, because it has the cancer of that organ or some other organ, whatever. So try to elicit the family history. Family history is also very important. Suppose you are treating a simple case of allergy of a patient, male or female, whatever. And then you get the history of cancer in father and mother and grandfather, sibling, or somebody else. You have to also take care of that patient, that he should not develop the cancer in future. You can give the antidote. Similarly, if you're already treating a case of a cancer and he has very strong history of cancer in the family, then you can give some antidote, some anti-miasmatic, for example, carcinosin, to that patient, because it has come from the genetics. So that's why family history and past history is very, very important. Don't forget generals as well, because these are the deciding factors. When you have like 4 remedies in front of you, which are organ specific, which are main remedies for cancer, or which has similar symptoms, for example, say, then what would be the differentiating factor? The generals, like sleep, food, like cravings and aversions, sleep positions, etc. So don't forget to take generals also. This will help you to decide the remedy. Try to look at the progression of the pathology, and please never forget to investigate. This mistake also I have done in the beginning of my practice. I if the patient is telling me that, doctor, I am feeling much better with your medicine, I never told them to, or never forced them to go for the investigation report, because in the beginning I was not worried about that. I just felt that, okay, patient is feeling better, it's good. But no, sometimes patient is feeling better overall, but the pathology is worsening. Sometimes patient is feeling better, pathology is regressing, but you don't know. Okay, and sometimes patient is not feeling better, still pathology is reversing. So in all these cases, you should know what is exactly happening to the carcinoma or the pathology. Very, very important to investigate. Never forget that. Note down the diagnostic reports date-wise. So have a chart with you which tells you that what happened to the patient 5 years back, 3 years back, 10 years back, 2 years back, recent reports. This will show you the whole graph of the patient, how his symptoms are going, how his diagnostic reports, and that will tell you that where you are heading exactly. This is very, very important, very vital information, especially in cancer cases. Because, in cancer cases, patient doesn't take only one therapy. There are very rare type of cases which will come to you and they will tell you that, I want only homeopathy or only allopathy or only this much. This doesn't happen. So this whole chart will also tell you that which therapy is going on and why the patient has these maybe side effects or after effects or whatever. Okay, so please note down diagnostic reports date wise and changes occurring into them. Take mind symptoms also, because we all know, being holistic physicians, that all the past griefs, emotional problems, stress, tension, in unresolved trauma, and it is also proven it has like deep link with the cancer. They have big role in the development of cancer. So if by the way, we take mental symptoms. It's not that we do not take it, we take it. But in cancer cases, sometimes we just overlook them because we are so concerned about the pathology. So don't do that. Take that. That will also a deciding factor in many of your cases. And it will also tell you that, why patient has developed cancer, why he has developed certain pathology. For example, I'll tell you, I can say that 80 to 90% of the cases which I have dealt with had some emotional trauma in the past, or I have seen that people generally, I'm telling you, not in a particular way, but generally, whatever I have observed, that generally the people who keep things with themselves, who are very closed, who don't share much, and who are very sort of introverted and very calm superficially, they would develop cancer at certain point of time in their life, because they're just not letting the things go. So if it is inside, and if it just gets piled up, and then it developed into something. So these are very important factors which will tell you the development, and then your remedy will also able to help those things. So let's talk about some do's in the cancers. So first of all, like I said, take the history well and never leave any stone unturned. Don't leave anything in the case. Take mental generals, physical generals, past history, family history, present predominant state, along with exciting factors, modalities, craving aversions, sleep patterns, sleep positions, the whole lifestyle of a patient. Because later I'll tell you that later you'll have to suggest him the lifestyle changes as well, because his lifestyle has got this gift to him of cancer. So we have to just tell him that this is the lifestyle, because lifestyle has a big role in our lives, isn't it? Second thing, ignoring investigation reports. Okay, just don't do that. Okay, so don't ignore the investigation reports and assume that patient is better. Don't assume anything, get it checked, and then act fast. Please act fast. In cancer cases, you have to do the follow-ups little quicker, frequently, and you have to act very fast. If the patient is not better, you cannot wait for next 2 months or 6 months or 1 year to change the remedy, or if he's not better, he's not better. If it requires changing the remedy, do it. If it requires changing the potency, do it. If it requires sending him to somebody else, do it. So act fast. This is very, very important. Okay, I've seen a lot of people just wait because we all know that it is a complex disease. It will take time, and please don't rely on one single dose or uh, a single dose, I would say, because you may need more doses. Even frequent change of the remedy might be needed sometimes, depending upon the condition. Sometimes you get that one remedy which heals the patient, but these are very rare sort of cases. Okay, but I'm not saying change the remedy just because it is cancer. I'm just saying that you have to be a little quicker to understand that it is needed. Second, do the follow-ups more frequently depending upon the staging. If it is an advanced stage, okay, if it is stage 3, stage 4, you have to take the follow-ups maybe every week or so. We never know. It depends upon the staging. And it depends upon the type of the carcinoma also. You need to understand what sort of pathology this is. Take help of the experts like, as a pathologist, oncosurgeons, general physicians, senior homeopaths, your colleagues, whoever it is. If you need help, please take it, because if you'll ask somebody, I am telling you, even if they are very staunch about their own system, they will help you because they also want best for the patient. So take help. This will increase the the trust of the patient in you, that okay, my doctor is concerned about me. And also this will increase your knowledge somehow. Always take consent of the patient in writing to avoid further conflicts. This is one thing which I have seen happens to many people, that because in most of the cancer cases, I'm telling you, death is inevitable. Okay, this you can just increase the lifespan, increase the quality of life, but in some cases you cannot prevent it, or you cannot even prevent the progression. You can just delay it. And sometimes the family or attenders, they will create trouble for you later, or even sometimes patients also. So please take consent of the patient. This is legal. You can take that, and it will be a good thing for you, for your future. So you would avoid a lot of conflicts in that. Follow the general protocol of the medical system. It is difficult condition to treat. You cannot, and please also, I want to say that don't make false promises. Don't say, we will cure it and it is 100% and homeopathy is totally, it can cure anything. Please don't do that. It will be a difficulty for you. Next, inquire about the lifestyle in detail and correct it if necessary. Lifestyle is a big problem of today's world, and most of the diseases are the result of the lifestyle problem, the wrong lifestyle. So you have to correct it. Being a physician, like Hahnemann said in the 4th aphorism, right? Preserver of health. We have to be preserver of health at the same time. So you're healer as well as preserver. So preserve whatever is there up to whatever extent you can. Okay, and suggest the lifestyle changes as well. Take care of the diet of the patient, because you become what you eat. You become what you think, right? So we take care of the mental food and we take care of the physical food as well. So both the foods has to be moderated. Whatever is in the best benefit of for the patient. Vegetarian diet is best because it has seen in most of the, if you look at the data, the statistics of cancer, you will see that the meat eating countries or meat eating areas where the consumption of non-veg is higher have more cases of cancer. Okay, and countries where vegetarian food or vegan food is more popular have less complication, or I would say less number of cancer cases. This is a general data. Okay, I'm not pointing to non-veg eating, but I'm just saying that this is my observation also, that vegetarian diet is best and it has less complications. Also vegan diet if possible. I have done this to many patients of mine where we have just kept them on vegan diet along with the treatment, and they respond very well. So this is my personal experience. So you can also compare in your patients that what goes best for them, and then accordingly you can modify that. It is possible to prevent cancers in future generations. So this is very important. Please understand this. It is possible to prevent cancers in the future generation. So you can suggest the patient to take homeopathy for their kids, or if they have, strong history of cancer in the family, you can give some preventive to them or their kids, whatever. You can make them aware that you can take that. Also, you might have seen the second session which Dr. Jyoti took, and Dr. Jyoti also taught us very nice thing that in her practice also, because she's practicing for more than 2 decades now, that she has seen that the patients who are taking taking medicines from her for any other complaint, not cancers, are less, I mean, they have not developed cancer in spite of having a very strong family history. So she just, when I was talking to her a few days back, she told me one case where, she was treating a lady, and this lady's sibling, cousin, mother, maybe grandmom, and other people, like other females in their house, everybody has like some sort of cancer, liver cancer, one has breast cancer, cervical cancer, and bone cancer. But this lady, because she was a patient of Dr. Jyoti for more than like 20 years now, she did not develop it because she was under homeopathic treatment. That this shows that homeopathic treatment is very beneficial to health overall. Okay, it will increase the immunity. So even if you have the history of strong familial history, still it is possible that you don't get that disease. So this information we have to pass on to the patient and patient's family, so that we can try at least to prevent. So it is possible. I have also seen in many cases it is preventable, in many cases. In some cases it is inevitable, so you have to accept that. Okay, then counsel the patient and attendees about mindful living, avoiding excesses of everything which is bad, the bad influences, the bad food, the wrong lifestyle, uh, the emotional turmoil, the stress, the tension, the conflicts. So you can just tell them that life is so short, and you understand it only when cancer happens, only when COVID happens, only when lockdown happens, only when somebody dies. So if we start living mindfully, we can live longer, healthier, and the quality of life increases like anything. This is a very important thing. Now, don'ts. So never ignore pathology reports. This is first. Second, don't delay the diagnostic procedure. Early diagnosis is very important. So if you are, if the patient is getting science, or you are getting science, that he may have something. Don't delay the diagnostic. Just tell him that please go to the diagnostic center right now or tomorrow, or as early as possible, and get this procedure done. So recently, I'll tell you what happened with my patient. One of my patient had hardness of the breast. So she came to me after getting this, some X-ray done or something. No, the USG was done. So she came to me and she said, I have a lump in the breast and my breast is very hard. And, somebody told me, her cousin was my patient. So my cousin told me that your treatment is very good, so please treat me. And when I saw, I could actually see this purple hue appearance. The nipple was retracted and it was stony hard. It was not little hard. The whole breast was stony hard. I said, it is not a lump, because in USG, they couldn't see. They just said that clinical correlation is needed. And, they told her orally that you go for some other investigation. I said, we have to do the FNSC and we have to see what kind of cancer it is. It could be cancer, most probably. This lady was not at all ready. And within 8 days, she developed a lot of pus and, mastitis and all those things. And then we got to know that it was a ductal carcinoma, okay, which also started spreading. So in spite of, telling her by different doctors, she did not go for the procedure. So same thing, I'm telling you that please don't delay the diagnostic procedure. At least you prescribe that. Whether the patient is doing that or not, it is upon patient's will. But from our side, we should not forget anything. So early diagnosis is very important because you can start the treatment very early, so that you can prevent the complications and further progression as well. Be open to incorporate any other healing method if that could be of help. Don't become staunch. This is my sincere request to everybody, that it is the question of life and death. If we cannot be staunch about even homeopathy, I would say if any other healing methodology could help the patient, we should incorporate that. I have so many patients who take, any, if they are taking any other system of medicine, say, for example, modern medicine, I'm, mostly I'm okay with it. And then when they are confident that, okay, they can leave that particular medicine, I allow them to leave, slowly taper that, and then they can be on fully homeopathy. But if they have strong belief on homeopathy and they can go ahead with that, that is also okay. But if you think that some other healing methodology is required, then please incorporate. I incorporate counseling a lot of the patients because you have to counsel them repeatedly. Don't ignore diet and lifestyle. Very, very important. In lifestyle, taking stress, indulging into things in the, which just affects you badly, or fights or jealousy and all those things. So just try to counsel them that please don't take the stress, don't invite the stress. If naturally it is happening to you, you cannot do anything. But if you are inviting it yourself, don't do that. Okay, along with the diet, if they are not taking nutritious diet, if they are not taking balanced diet, if they are so much into fast food, spicy food, oily food, fatty food or non-vegetarian, try to moderate that thing. It has to be nutritious, it has to be balanced, it has to be neutral. And also, there are so many cancers where particular food or particular thing can affect the course of the disease. So in that case, you have to avoid that thing. Okay. Also ask them to take more vitamin rich foods. Like, for example, with vitamin C. Vitamin C is very, very important to fight back the infections. So tell them to take more citrus fruits, more papaya, broccoli, and all these foods which has vitamin C more, like amla and all that. That helps. Try to understand the side effects of chemotherapy. This is very important. Sometimes we just take the case and we feel so lost. I'm telling you, you have to understand the states, which other treatments have caused. For example, if the patient is having some symptom, try to understand whether the symptom is a part of a disease or part of the chemotherapy or radiotherapy side effects, because there are so many side effects. And then you have to figure out how to deal with them. Some, instant remedies could help you. For example, radium brome. It helps the chemotherapy and radiotherapy side effects to control them and to reduce them. It helps. Never forget to counsel the patient about habits. For example, alcohol, smoking, spicy food. These are known risk factors. So when we know that tobacco causes cancer, okay, tobacco is a big risk factor. You are having mouth cancer, buccal cavity cancer, you're still smoking. This you have to counsel. If the patient is already having any sort of cancer, he's taking a lot of alcohol, this will not help. This is going to worsen. So counsel. Okay, so these are main do's and don'ts. Now let's have a look at common rubrics. So many people have asked me in last 2 sessions that how to go into repertory. So I will just quickly show you some rubrics which you can see, and you can read those rubrics and remedies given in them so that it will help you in your cancer cases. Okay, would you like to see that? Tell me. We have few minutes.
Yes.
Yes. Just a second. Okay, so quickly we'll go. So in generalities, you can go and just type tumors. It has 446 medicines. I know these are too much, but you have to look at the sub-rubrics, a lot of sub-rubrics. Okay, and see, like tumors burns after only one remedy. Tumors after injury is only 4 remedies. So I'm taking complete repertoire. Okay. Then cancerous affections. So there are majorly 2 types of cancer, sarcoma and carcinoma. Okay. So sarcoma. So see, in sarcoma, it has 49 remedies, and like below that, you can see serous. Okay. So cancerous affection, serous, 84 remedies. So you can look at the subrubrics. Ulcers, cancerous. In so many cancers, you will see open ulcers, closed ulcer, whatever, ulcer sort of affection. So you can take that. Ulcers, cancerous, or ulcers in glands. So in glandular pathologies, for example, breast is a gland, right? So you can take that if you see the ulcers on that. Cancerous affections of glands. Then cancerous affections, adenocarcinoma. Adenocarcinoma is also not that common variety, but adenocarcinoma you will see a lot of especially in lung cancer cases. So 8 remedies are there. And then you see this another subrubric, advanced stages. And we have 19 remedies. Very interesting, isn't it? Cancerous affections, hereditary. Can you see only 4 remedies? Lac maternum, lac humanum, sac album, and carcinosin. Inheritance bad. So if somebody has familial history, you can also think about this rubric, inheritance bad. Vaccination. We all know that repeated vaccinations or some vaccines, they could produce the tumors. So you can take this rubric. This is a common rubric which I use. So I am just sharing that with you. Vaccination after Almenstrom. Fear of cancer. So not only, rubrics related to pathology, but also this is very common. Fear of cancer, fear of death even, it is very common. Fear of disease, of being incurable, that मैं ठीक नहीं होंगी कभी भी. This is a common fear cancer patients will have. Fear of death. Anxiety, future about with sadness. I know I'm going to die. What will happen to my children? What will happen to my husband, my family? Sadness. A lot of patients I have seen, they have suicidal disposition. They have a lot of suicidal thoughts when they have cancer. This is a very good rubric, though it has only 2 remedies, but they have always helped me. Suicidal disposition, cancer patients, or in heredity. Okay, either they have hereditary suicidal disposition or in cancer patients. And both the remedies are actually almost like the cancer remedies, Serenum and Carcinus. Cancer in Patak repertoire, you can just go and search cancer and you'll get this rubric. Cancer open. See, arsenic, bufo, and kundurand. Okay, now let's talk about resources quickly. So I just want to tell you where you can read about cancer cases or the remedies related to cancer. If you just want to have a good knowledge about which remedies and how people can approach. So one book is Grimmer's approach. So Grimmer have written a lot of cases where he has used different remedies. It's a very, very good resource. So you can just search on internet in your softwares, in the books also, Grimmer's approach. Second, Burnett's cases. So Burnett has written many books and many journals also. So in that you can read Burnett's cases. Then lesser writings, you get a lot of cases and lesser writings in classical literature like Hahnemannian Materia Medica Pura, lesser writings from other people. Just You Think is a very good book. I also have it. This is the book. Just You Think. This is written by Dr. Sarkar. It comes in 2 volumes. Great book to read about some organ specific remedies or main remedies related to cancer. Then there are many new authors like Dr. Sarkar, I already told you. Dr. Farooq Master's book is there, Healing Cancer, I guess is the name. Dr. Sujit Chatterjee's videos are there. Dr. Khaneja's book is there. This is from BJN Publications. And also Banerjee Protocol is there. So Dr. Banerjee's, they use the specific protocol for cancer cases. And I have used that in some cases where I don't find a specific remedy. And that also helps a lot. You can go through the book, Banerjee Protocol. Okay, so at last, I just want to give you, 2-3 remedies which comes from Grimmer, and I have used extensively in my practice. So quickly, I'll tell you. So Kondurango or Kundurango, this is for cancerous tumors of the breast, epithelioma, carcinoma of the lips, deep cracks. So the main symptom of Pondiurango is deep cracks at the corner of the lips, and the cancer mostly originates in the epithelial tissues. Okay, this is a very strong indication. So in Boric also you see this, it is written in the bold capital letters, that painful cracks in the corner of the mouth. This is the guiding symptom of Pondiurango. Okay, second remedy, Kali Ayod. So Kali Ayod, Dr. Sarkar teaches us that, Kali Ayod is the remedy where you get a lot of like different organs are involved, very deep pathology and a very hot remedy, and lot of mental symptoms also. So it has cured many types of tumor. You can see that I have taken it in taken it from Grimmer's book. Okay, so it has cured many types of tumors and cancers generally based on syphilitic or tubercular groundwork. So if somebody has tuberculosis in the past, this becomes your indication to use Kali Ayod. Okay. And often there is present a combination of both these mechanisms in many cases of malignancy. Nightly aggravations of complaints, because it is a syphilitic remedy. As the pathogenesis of this remedy is too vast to incorporate in this paper, I will only give the leading mental symptoms. So a lot of mental symptoms like half mad all night, talkative, full of jokes, sadness, fright at every trifle, every little noise startling, apprehensive, lachrymose, irritable, irascible, especially towards his own children. This is very specific. Okay, so syphilitic notes. For syphilitic notes, it has been used condylomata in tumors of the breast and uterus, and it has tendency to bring an atrophy of the glands. So glands are like atrophied, not swollen. It also produces the infiltration. That is why we usually find edematous swelling wherever this remedy is indicated. Iodide of potassium, if used continuously and long, brings on progressing wasting with voracious appetite. Then you see this is so, so unusual that it has the wasting and it has the voracious appetite as well. So in spite of eating well, losing the flesh. It is anti-syphilitic, anti-scrofulous remedy combined in one. Okay, in Fatak also the same thing is written. Next remedy is Serinum. So Serinum is a nosode of cancer, correspond to the cancerous diathesis, cancer of the breast, and a very invaluable remedy to be given during the course of broad constitutional treatment. So this I use as an intercurrent remedy, like Rimmer said, enhancing and complementing the action of other indicated remedies. So this is how you use Serinum. So the Serinum, or some people call it carcinosin also, but there is little difference between carcinosin and Serinum. So Burnett is the authority for this nosode. He proved it on himself and produced a tremendous sinking at the navel. This is the keynote of Serinum, sinking at the navel, which he regarded as a keynote, and Burnett particularly noted its usefulness on cases of breast cancer. So treat cancer with sound knowledge and confidence in homeopathy, and you can create wonders. Don't feel less confident. If you have any questions or queries, you can just write in the chat box. And also, I want to tell you that, at the end of the session, we will send you a feedback form where you can write down your questions. And the next session, which would be a concluding session of this whole webinar series, in that we are going to take all your queries. So do send your queries for sure. Thank you so much. And now, without wasting time, I will just invite Dr. Hardik sir. Dr. Hardik sir is from Gujarat, and he's practicing from last more than 17-18 years, and he has done a lot of work in cancer. Sir, most welcome. Are you there? I cannot see you.
Yeah. Hi, good afternoon, folks.
Good afternoon, sir. Just a second, I'll ping you. Yeah, so most welcome. And now I'll just shut down my video.
Yeah, thank you again. If you allow me, I can share my screen.
Yes, sir, you can share now.
Is the screen visible now?
No, sir, I cannot see this the screen.
Just a moment. Now?
No. Can you stop sharing and start sharing again?
I will do it again.
Yeah. Yeah, we can see this.
We can see now. Now?
Yes, sir. It is visible.
Okay, perfect. So just we are doing an overview. We shared about some aspects of cancer. We magnitude. I will not go into that. But then I will start from few of the cases where we left last time. Because there are a range of speakers, everyone will be having something to share, some different approach to share. So one thing which I have learned so far is no approach is perfect. There should be multiple approaches to treat cancer. Sometimes a constitutional is needed and something, some very, very specific remedy is needed. So it can be like range of other treatment. I think we did all breast cancer cases. And then we left. Right. So we'll start from here. Am I audible, doctor?
Yes, sir. Yes, sir.
Yes, sir.
Fine. So this is a very interesting case, one of the eye-opener case for me. Now, this is a case of CA esophagus. She's a lady, 72 years when she came, and she had a huge mass in esophagus, and it was diagnosed some 5-6 months back, and she has some excessive salivation, which was very, very offensive. And the interesting part would be she would always carry a small bucket with her. The bucket would be of like 1 liter size bucket, and that was the amount of saliva which used to be get collected in hour or two, and she would have to drain that saliva, and again the saliva would be filled up. So this was the clinical condition when she came to us, and already there was some kind of esophageal cancer. The position for her to speak was almost impossible. What she had was a lot of reflux, severe dysphagia, and she had a lot of giddiness. This was the history. We repertorized, and we came to a very interesting remedy called Mancinella. And Mancinella is one of the remedy, again a prominent remedy for malignancies for esophagus. But the interesting part is the salivation, which Mancinella carries. If you open Boric or any book, you can find that what Mancinella has to do with salivation. So this was only input, two symptoms where we can enter. One was dysphagia, and another was this excessive salivation, like whole day need 3 to 4 buckets of saliva. This was a life. So after administering in Mancinella, within a month or so, we could curb her salivation. No more salivation, very normal salivation what everyone would have, and her esophagus improved, her dysphagia improved. So I won't say cancer gone, but symptomatically she improved a lot. She started eating. It was very difficult for her to swallow solids or liquids, anything. Everything was only regurgitated. But Menciner helped, and we later on shifted to Kondurango. This patient lived for 3 years. Okay, so when she passed away during the corona time, it was because of the heart attack. She suddenly had a cardiac arrest in winter, and because of that, she passed away. But she survived. She managed well with the pathology of CA esophagus. Now, usually CO esophagus once diagnosed, and the usual, the lifespan we expect is 2 to 3 years. So if you are able to break that ceiling of 2 to 3 years, we are doing our job. So Mancinella did that job, and later on the job was done by Kundorogo. This is one very interesting case, where I got insights of role of Mancinella in treating cancers, particularly relationship with esophageal cancer. So when we talk about certain cancers, certain medicines have affinities for certain organs. And I would say Mancinella, Kundurungo are two such medicines, particularly Mancinella, which are having affinity for esophageal area. And another remedy which I would definitely think and have given in this patient intercurrent was alumina. These all have affinity for esophageal reason. So this is one of the very interesting case. And what we do is like, replicate this result in another patient. So whenever another patient of esophagus, even if not malignancy or malignancy, if I have salivation, excess salivation ruling like this, I would think of Mancinella as a remedy which we can think of, because this is a very, very, very much verified symptom. So this is an interesting aspect. So salivation much better. So this is the follow-up of the patient. And in between, she once had mastitis. We treated, she was in purplish color. We treated with phytolacca. This is another case of CA esophagus, 55-year-old. She 3 months diagnosed against severe difficulty in deglutition, especially solid food, and suffocation in cold food. Now we started this patient with Ignatia, followed by Alumina 01, and we went till 03 till we are treating. And we put her on Hydrastis mother tincture as a support remedy. Again, see Condurongo, Alumina coming into picture. This patient also improved a lot. Now, another interesting group of remedies which I want to put up is this cases of NHL, non-Hodgkin's lymphoma. Now, let me tell you, NHL, the Hodgkin's lymphoma, they improve very good even with chemotherapy drugs and with radiations. Okay, so one algorithm which usually I use, if a tumor is well managed by chemotherapy or hormone therapy, they should be managed by homeopathy, because we have survival time in that patient. And NHL, the book says they are one of the curable tumors. So when chemotherapy drug says curable, means homeopathy also has to have that same prognosis with it. This is one such patient, okay, diagnosed with NHL since 1 year, severe fatigue, severe loss of appetite, edema, deep abdominal pain, and always she would complain. He would complain with pain only. Right arm pain, particularly while lifting backache. We started with Basilinum 200. Now, Dr. Yamin, you were pointed about Burnett. Now, Burnett mentions about this remedy, Basilinum, much, and the role of Basilinum in treating NHL. Lot of literature regarding Basilinum and Burnett. Already we know about ringworm and Burnett, but Hodgkin's lymphoma, non-Hodgkin's lymphoma and Burnett. Another interesting remedy which came up in this is Sister Scan. Now, Sister Scan is again a remedy which is very much useful to treat glandular tumors. Prominent remedy. Two remedies I must say. One is Sister Scan, another is Crofulera nodosa. And another one is Aconitum lycotonum. I don't remember if I've taken a case of that or not. But Aconitum lycotonum is a small remedy listed under Aconite napellus. So I would completely owe this remedy to Dr. Sarkar. Had it been not Dr. Sarkar, the world wouldn't have knew about Aconitum lycotonum. Immense role in treating NHLs. Texas baccata, I discussed about this remedy in previous session also. Texas is one of the remedy which is actually, it's a pine conifera family remedy, and it has been grown in Himalayas and most of the European alpine regions. Texas baccata, I would say it's a very old contribution of homeopathy to this field of chemotherapy, I would say. Why? Because Texas baccata extracts, they are called paclitaxel. Now, paclitaxel is one of the very commonly used chemotherapy drug, the paclitaxel protocol. It has been extracted from this. And a lot of agricultural pine farming of Texas has been now going on in Himachal and in Kashmir. Why? Because there's a huge industry for getting paclitaxel to be drained out from Texas baccata. Another interesting remedy, gallium heparin. Bernoville is one such author we must read. I will come to that. Bernoville, enforces that gallium heparin is one of the remedy which can be used as the drainage remedy. So when lymphomas or even in breast cancer or oral cancers, when lymph node involvement is there, gallium heparin is of a very good help. So this is one such case, again improved after the medicines. Now this is a case 32-year-old came up with giant cell tumor. And giant cell tumor, D7 vertebra, okay, benign wedge fractures, and she was given radiations, palliative radiations to reduce the pain, severe pain in the spine. And I would always say, initially patient is having severe pain, palliative radiations like 10 or 11, 5 to 10, how the radiation oncologist plans, doesn't harm much to the patient, because sometimes, we have to think practically. Like if we are so much dogmatic about our homeopathy, that whether to give homeopathy or not homeopathy, then radiations are bad. It is not actually. Sometimes, the course of the treatment is also been decided by the patient. See, the patient is already having a fracture in a spine, and it is unable for her to get up even. And at that time, if we are so adamant that we'll think of homeopathy only, and if you're not able to relieve that pain, then it is bad. It's bad from us. We cannot be dogmatic. We have to be, going with the flow for the patients. And ethically, we cannot tell anybody no for any other treatment. It is patient's choice, and it will be patient's choice. Whatever amount of, knowledge you feel that chemotherapy kharab hai, radiotherapy kharab hai, sahi hai, but some practicalities are always important. In this cases, she was given palliative radiotherapy, which helped her a lot. And then she came for the leftover pains. Now, this pain had, she had left-sided pain. She cannot sleep, a lot of perspiration along with. She was along with the zoledronic acid. Zoledronic acid actually is not a chemotherapy drug, it's a bone cement actually, once in 3 months. So it doesn't harm much, it only helps. We started her with, arbor vitae, that is Thuja. We gave her in a rising potency like 30 to 101 m. And then we started with Ruta, considering the organ. Now, these patients also improved a lot. She followed up with nearly for 3 years. And after that, she was pain free and she was symptom free. So this is one surgeon. Giant cell tumors of vertebra are not that notorious cancer. So in young age, responsive tumors again. Nothing else was given. Okay, no other chemo was given. Only palliative radio initially to relieve that pain was given. So role of Ruta again. Thuja we know, but role of Ruta in treating cancers. Dr. R.P. Patel has an extensively been telling about Ruta for cases of clear rectum, but for bone tumors also Ruta works very nicely. Ruta is also one of the drug which Dr. Sunirmal Sarkar and they use it for, whenever patient is going with chemotherapy. If this going, start along with uranium nitricum and Ruta. Prepare the patient for chemotherapy. So in this patient particularly, we again reviewed because after she had some pain, after she doing some household chorus and all. So we revised the case when we put her on ovary, looking at the estrogen component for bones. So this is some interesting aspect, a very different approach we can take sometimes in bone tumors, role of estrogen or role of ovaries. And we also put her on Hecla lava later on. Later on, she felt pain in left scapular region, chilly, tingling, numbness, and we again took the history and ultimately we started later on with calcarea silicata. Now, this was the time we entered in this patient with the constitutional treatment. Sometimes, whatever the constitutional remedy we get, it doesn't work initially. You have to go on the course with some local remedies, like we did in this case. And at the time, we introduced this remedy like calcarea silicate. Like previous also one case we started Staphylococcus aureus very later on. Although it may seeming like that this patient is Staphylococcus aureus, she can be nothing else. But there is a timing, when to intervene with a remedy and when not to intervene with a constitutional remedy. So I would always say, treating cancer is an interplay of using local remedies and constitutional remedies. So these were the 2-3 cases which I wanted to discuss. Now, the point where which I left off is the approach to cancer cases. So this thing I will repeat. Okay, early detection of cancer and treatment. The more, the earlier, the merrier. It is also good for an oncologist. It is also good for a homeopath. So homeopathy, along with chemotherapy, radiotherapy, and surgery, we should never say no to it. Patients after chemo, radio, surgery, we have a role. Pain management, we have a role. Symptomatic management, we have a role. Side effects management of chemotherapy, yes, we have a role. Psychological management, yes, the reassurance is one of the very, very important thing. Dr. Yamini also pointed about that. And palliation. So this palliation treatment is something, it's very unexplored territory as far as homeopathy is concerned. It is a well-developed method of palliative care in oncology field. But if we are able to develop certain protocols, certain remedies, We just help to palliate the patient. It's a very big thing. A lot of data has to be now generated. And these days, many homeopathy doctors are treating cancers. If we can collect data and form some protocols, it can be a very helpful tool. This thing is mandatory, a very detailed clinical history, very detailed, proper anamnesis of the case, how it started. It can be something like a burn or an injury or an infection or an inflammation or some psychological case. Search for the causative factors. Oncogenes is very important. I think, can someone mute herself or himself? Yeah, thanks. Yeah.
Which I have done.
And it is very important that, as a homeopath, we should know about the chemotherapy drugs, adjuvant therapy drugs, because patient will be coming to us, either they will be taking or they already taken. So aphorism number 3, knowledge comes into picture here. If you are not knowing what other remedies are going on, other treatment is going on, how we are going to treat patients? Because many times after chemotherapy, patient will be there only with the side effects. Forget the tumor. They'll come to us with the side effects of chemotherapy. What to do? So that important. So what needs to be treated in the case? It is very important. I like this quote. If nothing happens, nothing happens. There is some relationship with some causative factor for a cancer to develop, to evolve. Because when we are born, that day we are already carrying cancer cells. But in most of the people, they are like sleeper cells. They are not active. But there are something which happens in life and cancer erupts. So always try to find out what was this, what happened and how cancer started. Anamnesis is very important. These things we discussed already previously. So, cancer treatment is clinical. Various facets has to be needed. So I would like to point out these 4 stalwarts again: Grimmer, Clark, Burnett, Bernowell. I would say without them, your kit is not fulfilled if you want to treat cancer. Insisting again, these 4 people, they are like, path breakers of treating cancer with homeopathy. Dr. Yamini also mentioned about them, but huge work. Now let me go to some interesting remedies. The fonts are a bit slow. I will just try to make them bigger. But one of the remedy, Sister Scan, I already told. Another interesting remedy, Syrinum. Very interesting remedy. Okay, it's a carcinosin again. Very interesting remedy. Use it at a constitutional, use it at a local remedy. Usually you find history of some worms when you want to prescribe Syrinum. So that's the prescribing point. Cadmium fluor. So most of us have not used cadmiums, but whether it been cadmium fluor, cadmium phos, cadmium sulf, cadmium mat, any cadmium, they're having a huge role in treating cancers. Keep this in your kitty, in your medicine kitty. Hydrastis mur, again a less prescribed remedy. Uterine hemorrhage, one of his forte. Euphorbia, very popular remedy. Okay, it relieves a burning pains of cancer. But somehow in my practice, euphorbia has never helped me. It is most celebrated remedy, most known remedy for pains of cancer. But somehow I always fail with euphorbiums. But then if you look at all euphorbiums, there are 7 or 8 euphorbiums in homeopathy. All are used to treat pains of cancer. Whole families, in fact, that euphorbiaceae. Cadmium iode, one of the very interesting remedy now. See, there is an iodum angle in it. So you can see that iodum is used for treating neck, tonsil, thyroid, mammary glands. So lymphatics, testicles, ovaries. So iodum has to play a role, and cadmium. See, remember cadmiums for treating cancers. Berno will put some very interesting remedy. One such remedy is gallium heparin. Okay, very important remedy. It is, ulcerated cancer, lymphatics. Think of giving gallium heparin. Now, radium brome is celebrated remedy when to treat like patients with radiation effects, but also X-ray helps a lot. Very important remedy. X-ray is also working wonderfully, as good as radium brome. Scrofulera nodosa, yes, again a very interesting remedy. But Scrofulera nodosa and Sister Scan, these are, I would say that they are brother and sisters. But both remedy have deeper constitutional symptoms. Do not ignore that. Ornithogallum is one of the very interesting remedy. Like very important remedy for C. stama. Very important remedy. Usually ornithogallum is a remedy which is also under backflower remedies. It takes care of 2 things. Definitely for CA stomach, but emotionally, if patients are in shock, they are unable to accept that I am having cancer. Ornithogalum is one of the remedy which can and which should be given. Sometimes it has to be given constitutionally. Many times I give ornithogalum in a backflower form along with the main remedy. So it helps a lot. So that is ornithogalum. Cinnamomum, if I am not wrong, I told about that remedy, the home cinnamomum. Very important pain remedy. Let us go to Burnet. Okay, some interesting remedies like use of Balispar. Very important remedy when Balispar patients are having history of injuries and they develop breast tumor. I think Shruti has used Balispar a lot where there is history of injury. Lappa minora, one of the remedy which is we do not know. Very interesting cancer remedy. Auramur natronatrum. Okay, now this is a very famous remedy to treat uterine fibroids, but I would say Auramur natronatrum is one of the remedy which is a cocktail of Staphysagrea, Aurum met, and Natrumur. When you find that picture is very much nearer to mental state of Staphy Aurum natromur. There are few cases that are given Aurum natronatrum. Cancer or not, there is a separate thing, but Aurum natronatrum is a very deep constitutional feature. Rubia tinctora, okay, one of the very interesting remedy used for splenic affections, anemia. I use it this remedy, for splenic affections, and there are blood disorders. Rubia is a very interesting choice for that. Lepisalbum, again a remedy we think of treating of this in treating the what we say lipomas, but very important remedy for ovarian tumor and breast tumors. Kundurango, affinity around mouth, very celebrated remedy for that. Now let me tell some of the Dr. Sarkar's excerpts, where like this has been out and out learning from him only. Like patients of cisplatin, if patient is taking chemotherapy drug called cisplatin. Cisplatin is like penicillin of chemotherapy, oldest chemotherapy drug. Patient is having symptom of platinum natrum, it is nothing else but natrum platinum. Think of giving cisplatin. Specific affinity for testicular cancer, ovarian cancer, renal cancer. Okay, particularly bladder cancer also cisplatin works very nice. Now these are the potentized versions I'm talking. So cyclophosphamide, again a very popular drug. It is especially used for bladder tumors, leukemias. Another remedy which is epipodophylotoxin. It is nothing else but podophyllum which we are using. Okay, Hawkins disease is one of its forte. Etoposide, one of a chemotherapy drug, it is an extract of podophyllum. Now, if you know that dermatologists treat warts using podophyllin, okay, so that is an interesting podophyllin extract. So it's a potential chemotherapy drug. A very simple drug we use for diarrhea and GIT problems in children. It is having a potential, presence for treating cancers. Another interesting remedy is flutamide, the second remedy in the list. Very important remedy for prostate cancer. It is very much like Thuja. Flutamide, one of the invariable choice whenever we are treating prostate cancer. Now, again, coming to prostate cancer, very much a treatable cancer. Very good scope. Very good scope with homeopathy. Tamoxifen potentized, again, very much similar to hydrastis, where there is increased hunger. That is a key thing. Paclitaxel I talked of. These three important remedies, agrimony, ornithocalam, and willow, these all are backflower remedies. But agrimony, very, very, very nearer to Natramur ignatia, particularly I would tell ignatia. But then ignatia is like, a lot of grief, but patient is hiding the emotions by keeping a fake smile on the face. That is agrimony. And agrimony is very important potential drug whenever we use, history of grief. And I shared some couple of cases regarding agrimony before. Ornithocalam we just talked about, and willow. And I talked about a case of CA lungs previously in the last session. We were adding willow, where there's a lot of despair. Okay, very much despair and grief and resentment and everything. Willow again is a backflower remedy. Willow is again nothing else but the English willow, because cricket bats are made from the English willow. The same remedy. Another interesting but small remedy is Nigella sativa, is a Kali Jiri. The only medicine which is mentioned in Quran, Holy Quran, is Nigella sativa. It is Kali Jiri. If you are able to, make a kada of it, Kali Jiri helps to support cancer patients. It's a very good antioxidant. Curcuma longa. Nowadays, a lot of advertisement is coming that, the level of curcumin, and they're selling haldi. It is nothing else but the haldi, very important remedy for curcuma longa. Curcuma longa, particularly, personally I have used in treating is having affinity in gallbladder tumors. Of course, all hepatobiliary tumors, curcuma is having a big role to play, but gallbladder tumors, we have been using it successfully. Gallbladder tumors, once diagnosed, the survival rate is 1.5 to 2 years. If you are able to break that 2 years ceiling, you're doing a job. If not, then we are not doing a job. So we'll skip this. So let us come to some interesting small remedy from boric. One such remedy is Calcarea ars. Okay, very important remedy for pancreatic cancers. We have used this remedy successfully in treating one chronic pancreatitis case, but in chronic in cancer of pancreas is severe pain, because pancreas is an organ which it causes severe pain. One of the very interesting remedy. Now this is a hidden remedy. Okay, we usually think of Calcarea ars in some cardiac disease, but it's a very important, having affinity on pancreas. Okay, acetic acid, one of the remedy, definitely for wasting, debility, and everything. Okay, Asterias rubens, again having affinity for breast cancers. Very good. Buforana we know. I won't go into that. But then please focus on Calcarea ars. Just open boric. I'm not using any fancy literature. This is just boric. What boric has to say. Another 2-3 interesting remedy on boric gives us is citric acid and citrus limoni. What is this? This is nothing else but lemon. Okay. Now what is lemon? Citrus limon is lemon seed, is having affinity for mouth cancer. It is a pain reliever. Interestingly, citrus lemon is which family? It is a Rutaceae family. Ruta, same family. Okay, these all are remedies for treating cancers. So Ruta is one such remedy. Citrus lemoni, same family. So whole Rutaceae family is having affinity for cancers. Few interesting remedy again from boric. One is Lobelia arinus. Now a special mention to this remedy. Why? Because Lobelia arinus is nothing else but the Lobelia inflata. It's a tobacco family. Okay, we have the Indian tobacco which is called as Lobelia inflata, which is very important remedy for lung problems. Asthma, we use it, Lobelia. But if you take some pill and read the relationship of Lobelia inflata, there's a small remedy called Lobelia arinus. Okay, where it is mentioned at malignant growth, but the interesting aspect is the extreme rapidity in development. That is the important aspect. If the tumor is very fast developed, Lobelia arinus comes into picture. Now see, when we are treating a patient, we just take history sometimes, but we are not matching the pace of the disease. We always tell about it ODP, 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 origin, duration, progress. But if the progress has been rapid, particularly cancer, and if the affinity is the oral or GI tract, think of Lobelia arinus. If the tumor is slow developing, dear friends, Lobelia arinus is not going to help you. So sometimes matching the pace. I always say that, treating cancer, treating any patients, how serious are we considering the ODP, origin, duration, progress? That is the important aspect. So one remedy from this slide would be Lobelia arinus. Rest of I talked of. Sempervium, cancer of the tongue, but mostly Sempervium will be used when the tumor is bleeding. If not bleeding mouth tumor, Sempervium won't be of a helpful. I told about Aconitum lycotonum, spelling of glands, Hawkins disease, non-Hawkins disease. So this would be my, kitting. If nothing else, I must have carcinosin, Staphylococcus aureus, Ignatia, Oromet, Ruta, Hydrastis, Phytolacca, all the iodoms, a bag of backflower remedies like Agrimony, Vilo, Ornithogalum, definitely. Certain sarcodes like thymus, thyroidinum, progesterone, estrogen. Nosodes, particularly cancer nosodes like Syrinum, potentized glioblastoma, potentized adenocarcinoma, and some specific potentized cancer. Nowadays, we have something like cancer carcinosin 5080, which is mix of 58 tumors prepared by Helios. It can be very much of a help. Potentized chemotherapy medicines like methotrexate potentized, cisplatin potentized, very important. And there's a big role of phytochemistry which is coming up these days. So that is a very different set of topic, but then we can discuss it some other time. So this is it, which I wanted to share in a nutshell. This is the thing, what are the challenges and what are the possibilities. The most interesting point would be, which it is very, very practical, but we are shying away to discuss, is research. And we are only a 250-year-old system of medicine. Okay, and the provers used to be 7, 8, or 10 or 15 when Hahnemann proved the medicines. Nowadays, it is very difficult to get even one prover. It is a struggle for one to prove a remedy. And after proving a remedy, the another challenge is come is that how this remedy is going to be useful, where it has been verified and then to put into repertory. So most of the modern repertories are directly the extracted symptoms from the provers, so we do not know whether it is proved or not. This is a challenge. So in the world of research these days, and nowadays the world is been gripped by chat gpts. Just put homeopathy and research, it will funny, just try tonight, use chat gpt, put research in homeopathy. You'll be shocked to see where we stand. So the era is going to be of research and homeopathy. So if we are not able to match that pace, we are going to go down. So this needs to be taken care of. And this is cancer, dear friends. It's not simple thing. Okay. We cannot claim. Bold claims are only possible if you have a huge database, huge research database. Few doctors, yes, they do, but most of the doctors are sitting in their clinic treating patients. They are not into research. But if I can ignite that, and if you're able to do some big level research in treating cancer with homeopathy, we can contribute. And it is going to take some 10, 15, 50 years down the line. If we are not doing that, sure shot there is death of homeopathy. If we are doing that, sure shot there is a rise of homeopathy. Thank you. Yes, Dr. Yamini.
Thank you so much, sir.
Yeah.
It was wonderful. In such a short time, you shared a lot of remedies and I love the last part which you said that a lot of challenges and a lot of possibilities also. So I have also improved on this, that to keep the data, because that will only tell us that what works and what doesn't work, and it's a huge field where we can work a lot. Sir, I cannot see you.
I just logged in from a yes now. Yes.
Yeah. Now I can see you. So thank you so much. I'm so grateful for you that you shared a lot of knowledge with us, and I'm really sure that all of us who are watching will get some inspiration, some motivation to work in this field, and also get something out of it, whatever it is.
Welcome.
But we can just go ahead with whatever we can absorb at the time, and then take that ahead.
One line I want to add. We are a very
please.
small world. We are in minority worldwide. I would say we nowhere exist. Okay, it's India. We are lucky that you are a homeopath. Just change your country, and you are nowhere.
Yeah.
As a homeopath. So इतने छोटे से वर्ड के अंदर, why we want to hide our prescriptions? Why want to hide our knowledge? Keep sharing. This is the simple thing, and just let the baton go on. It should be passed on. There are no secrets in homeopathy, and if there is, then that means there is something fishy going on. Share a prescription. You give one remedy, you share. You give two remedies, please share, Baba. But tell honestly.
Yeah.
This should be the mantra. Very simple.
Very true, very true. Even, honestly, I would share one thing here, which I always say, that I have seen even, in some cases, I have seen that even these multiple remedies also have worked. I don't know what worked, but, in some cases, I have seen that few people who would prescribe like, I won't say polypharmacy, but one after another or something like that, that has also worked. So we have to find out exactly that what is happening in such cases, and we can, learn from that as well.
I remember one small discussion with Dr. Farooq Master in Turkey, Istanbul, this Liga. Okay,
Yeah.
he just shared about one doctor in Delhi. He was treating cancer, and we were just sharing, some very light sharing. He told that I am finding one doctor, but I couldn't meet him. He was a homeopath. He was giving some 16, 17, 18 remedies at a time to one patient. But then he was treating cancers like anything. Unfortunately, he passed away very early in his early life during Corona. So no one could find him. Now this guy is not been, no one knows about him.
Yeah.
Now Dr. Farooq also regretted that I couldn't meet him. But इससे भी क्योर तो कर रहा है. क्या कर रहा है वो तो जाने जाके. True. These are exactly I'm recreating words of Dr. Farooq.
Yeah, and very rightly you said that it's a small world. We are nowhere, and there are so many possibilities. Or Hamisha, that there is this strength in the unity. So if we could share, learn from each other, it will be a great world for everyone. So thank you so much, sir.
Yeah,
Everybody
welcome.
thanking you.
My pleasure.
And
Thank you.
people are also requesting for your slides. So it's just a request if you can share.
Yeah, no problem. I will share. That is fine.
Thank you.
It's
Thank
completely
you.
okay.
So, guys, we will send you the slides. And also, I would like to tell you that this video will be there on the YouTube. So even if you want to, go through, you can just go through the video and take the screenshots. I guess that will also work, because in the video we will keep forever. And also, I will just put here. Uh, this is a link of the feedback and questionnaire. So I'm just I'm just putting a pin on this link. So kindly, go through the link and send us your queries, your questions. This whole webinar series we have done only to make people aware and make them feel a little confident. Okay. So if you have any queries, we would love to discuss them in the next session, which will be a panel discussion amongst all the speakers. So please do share your queries and your feedback and your learnings, whatever you want to say related to the topic, related to any speaker, or related to whatever you go through while treating cancers. It would be great to hear from you. Okay, so it should be a two-way traffic, not a one-way traffic. So thank you so much, and we will see you next Friday where we will have a discussion. Sir, I'm very much thankful to you, so grateful, and have a good day.
Dr. Yamini?
Bye.
Yes.
This is Ashok here.
Yes, sir.
I have a request for two things.
Yeah.
That today's lesson, and especially of our doctor, he have spoken, even the first lesson I have seen, that it was too much, very big informations, very great informations that he gave. Yeah. Certainly, time is very short, but the information are too much. So I even requested first time that if it is possible to slow down a little to understand more, only reading in few minutes, all this literature, really precious. I should, third time when we say something means is something valuable. Thank you very much for all these sessions. But I need to have this YouTube link for all the sessions if possible.
Yes, sir. I will surely share the link in the group. I have your number also. I will share it privately. So you can watch. There is this live section in the YouTube where you can just watch and, rewatch the video. I will send you the link.
So, doctor, I want to share one thing.
Yeah, please.
I completely agree with you. That time is so short, but this 1.5 hour session, 2017, we had a session in Surat, my whole day. So we couldn't complete this in whole day.
My goodness.
And there are a few cases which are added. But it is, I completely agree with you. Cancer is not a 1 hour thing. But we are just, this is a highlighter, like as a teaser kind of thing.
Certainly, very precious. Even if it's a highlight, is something to reach on. I must add it because I'm not here to speak myself. I was for more than 23 years, totally is now 26 years with Dr. Spinedi in Switzerland. You might have seen in Turkey also that he's from Switzerland, the only Dr. Spinedi who's working with the cancer. So from 95, we were together. It's a school also, it's a training also, everything. So what I added many this remedies, what you told today, it was in addition to that, my work for 25 years. Thank you very much. And I appreciate that in case we can have more lessons with you to understand more remedies, and especially all these things, what to care, what attentions, all this last part, as Dr. Yamini told, that it's very important. Thank you very much, really. Bundle of thanks. I don't know how to say. Please we'll listen again. Thank you very much.
Welcome,
Dr. Yamini.
Thank you, sir.
Thank you too. Thank you very much for organizing such beautiful things. Thank you.
Thank you. And like you said, we could also try in the future to, to invite sir and have something in little detail. So we will try that.
Thank you. Great. Thank you.
Great. So thank you, everybody. And we will meet soon next Friday. Please do share your feedback. Thank you, sir. Thank you so much.
Good day to all.
Good day.